Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have a person with me, Brooke Benton, RDH, and she has an amazing journey to share with us. Brooke, thank you so much for being on today.
Thank you so much, Kelly. I'm so excited to be here and be a part of the podcast.
She, you guys, has taken the role of a hygienist that is the one that we learn about maybe in hygiene school if you're a member of ADHA, I hope you are, that is the role of the researcher. And Brooke, I'm so excited for you to tell the story, but to start, why hygiene? Did you choose it? Did it choose you?
Well, it's funny that you asked that because I feel like I kind of have maybe some other people have this experience too, but I actually had aspirations to become a dentist. So I was the weird child that always liked going to the dentist. I was never freaked out by it. I wanted to have the mirror. I wanted to see everything that was happening. Somebody who's experienced ortho and you have to go to the dentist every couple of weeks and get those brackets changed. You become very comfortable with it. And the team that was doing my treatment was so wonderful. And so I really just thought this would be a wonderful profession. And so I did my undergraduate degree. I got my bachelor's of science in biology and chemistry. And I took my DAT. So I'm Canadian. And so in Canada, you do the written portion and the soap carving. So I did that. And, my score wasn't as competitive as I would have wanted it to be. And so I thought, what am I going to do? I know I love the field of dentistry. I'm going to, take a pause. I'm going to apply for hygiene. I can do that for a year. I'll retake my DAT and then I'll probably go to dental school and then I'll just, be a more competitive applicant and I can go in with some insider knowledge because in undergrad, you don't learn about dentistry. I mean, you learn a lot about medicine and all of these terms, but there's not really a dental course. So to have that underlying kind of information would only serve me. So I applied to hygiene. I got in. I didn't take the route of dental assisting. So I was really, coming in fully fresh, didn't know anything, totally naive. And first year of hygiene, I just fell absolutely in love with it. I knew that it was for me. I said, forget dentistry. Who needs that stress? Who needs that? I want to be connecting with my patients. I want to be connecting with them. And I think that not being in dentistry, so many people look at hygienists, oh, you're just cleaning teeth. But it's, as we know, so much more than that. And so being that empathetic person and being able to bring that chair side was so important to me. The education part of it, spending more than 2 minutes in the room and doing a quick check. So that's how I got into hygiene. And I had a wonderful experience in my dental hygiene program. I had amazing faculty and teachers, some of whom I keep in contact with today. And so I did my 3-year program. And while I was doing that, I was working as a research assistant in a hospital, doing systematic reviews and literature reviews on stroke and acquired brain injury. So I have always loved research. I've always had this kind of inquisitive mind and wanting to get to the bottom of things. So research was a really good fit for me. And it was a great part-time job as I was working through the hygiene program.
Yeah.
And so when I graduated, I was able to work in a private practice. I worked for a large dental corporation and I was doing that 4 days a week. And then I was doing my research 1 day a week. And I found that, I think some people can relate to this experience that the dental corporation just really wasn't aligning with my personal goals and ethics. So I ended up moving to a smaller dental office that was in a more rural community. We served a lot of Mennonite population. So there was a barrier there with them mostly speaking Low German and not really understanding the benefits of community fluoridated water. And, we had a lot of rampant decay. And so that was a whole new experience coming from an urban setting where the population was mostly looking for cosmetic hygiene and dentistry. So that was a great challenge. And I really loved working in that office. And I really enjoyed my dual role as hygiene and researcher. And then in 2019, myself and my husband, we moved to New York City. We moved to Manhattan for his career. He's a neuroscientist and started his postdoc at Columbia University. And so we made the move to New York.
That is so cool. And then, so how did you, because you were able to do so many more things in Canada than you
Yeah.
probably are in New York. How did you navigate that?
Yeah, so that was, a real challenge for me, as a working woman and as somebody who works so hard to get that career. It's not an easy program, and to become a hygienist, I wear that as a badge of honor. I worked so hard, and I was so proud of my career, and I felt that that really was part of my identity. And then moving to another country, I couldn't practice in the States. I didn't have a work visa at the time. So I was on a spousal visa, and you have to apply for work permit and authorization, and that's a process that takes time. And so I wasn't able to work at all in New York. I was
Mm.
fortunate enough that I kept my research position from Canada. I did that remote for a year, and then I said, I need to get myself into a community here and start, feeling my life and identify with New York. And so my first job in New York, I worked at Columbia University, doing Alzheimer's research. So I was working on clinical trials with Alzheimer's patients, and that was really wonderful.
So
And then
cool.
COVID happened, and it affects so many people, right? And the workplace just looked so different. It wasn't considered um, something that was necessary. So I started working from home, and just the dynamics of that really were not working well for me. And so I had always, felt that disconnect. I loved research, but I was missing that piece of dentistry, that piece of hygiene. And so I was looking at what other opportunities might be available to me. And I stumbled across NYU College of Dentistry and the Translational Research Center, and that's where I work now. So I'm a part of a team at NYU University, and we study mostly oral cancer, so squamous cell carcinoma, and precancer patients, dysplasia patients. And while I've been working there, I've been fortunate enough to get my dental hygiene license here in New York, and now my role has sort of expanded. So I'm not only doing that clinical research piece, but I'm also working in the capacity of hygiene. So I'm doing oral exams for a multitude of different studies, but the main one is actually looking at low income pregnant women and their utilization of dentistry and healthcare. So I do oral exams and work on that study, which has been really rewarding and beneficial, and getting back into it, dipping a toe back into the chairside work that I haven't been able to do for 5 years.
Yeah. Wow. You guys, wow. Right. And it's, did you think, looking back when you started dental hygiene school or even 5 years ago, did you think that you would be doing what you're doing right now?
No, absolutely not. And, I think that uh, there's just like a traditional path that I think that most people kind of see themselves falling into. I'm going to do my program. I'm going to get a great job in an office, and that's how I'm going to go. And that just like wasn't the path for me, for better or for worse. And it's been so exciting for me to be able to kind of blend these two passions that I've always had that I didn't really know. I feel like a lot of people don't, they're not given that information as part of the education of what all a dental hygienist can encapsulate. So I feel very fortunate to be doing what I'm doing and have, a bit of a different story.
Yeah, you've taken it. And what I love about our profession is that we have so many transferable skills. And what it sounds like to me that you did is you followed your curiosity and you followed sort of like what you're interested in, what still fed you, fed your soul, fed your brain. Because you said you had that, you always wanted to know more. You
Yes.
always had more questions. You were that curious hygienist of, how does that work? And wait a minute, that doesn't make sense. And so that led you to where you are now as, a research assistant. Is that what's your
I'm
formal
I'm
title?
a certified clinical research coordinator or assistant research scientist. They go by many different titles, but it's funny you say that because I always like to say that, tenacious doesn't always have to refer to calculus. Like I think of myself as a very tenacious person, and I try and apply that in all aspects of life.
How did it feel? So you talked a little bit about identity crisis and what you were when who you thought you were, right? When you left Canada and went to New York and you were a clinical hygienist and all of a sudden you weren't. And you still had that facet of who you were with that research background. Did it feel weird? Like, what did you have to go through to say, I'm not a hygienist, I'm also this?
Yeah, I think that there was like this kind of sense of loss and
Mm.
just trying to reevaluate what my long-term goals were. So right now I'm working in a research capacity, but ultimately my long-term goal is to get into education. I think that that's where I really strive, and where some of my skill sets really lie. So ultimately, I would love to get into a program where I can educate future students and future hygienists. So how do I get to that path? Always kind of knowing that that's the direction that I want to go. Where can I take my current skills? And like you said, it's so transferable. And I think that a lot of us hygienists are very meticulous, very
Mhm.
detail oriented, perfectionist type A. And that can lend itself to many different careers. And I think that it works really well with the research career. The level of organization and attention to detail I have to bring to everything that I do in my day to day work. Felt very natural to me and kind of an easy segue. And the great thing about clinical research is what I'm doing now is that I still get that, patient interaction. I think that it's so important to come to a situation and really hear people's stories and really understand what they're experiencing and going through, and not just looking at it through like a lens of sterility. And I think as hygienists, we do that really, really well. And I've been able to apply that to my current role. So I was able to, look at the big picture and look at the strengths that I bring to any profession.
Which is where it starts with self leadership, you guys.
Yes.
It's important to know what you want and what you don't want to get clear, because you can like several different things. But if we end up in a position, or a position isn't finite, but in an area of life where we're not enjoying it, it shows up in other ways, and our way that we're not aligned with that. And so, Brooke, what it sounds like that you went through is saying, okay, what do I know that I love? And it doesn't have to always look like this, because also, too, you could have gone through something where you thought that to be in the role that you're in now, that you have to have a PhD or you have to do this, right? And so that sort of like imposter syndrome of stepping in to where you
Yeah.
were like, wait, me? Can I do this? Did you go through that?
Absolutely. I think that it's so easy to fall into that sometimes, negative headspace and say, like,
Yeah.
well, what do I have to say? What do I have to offer? Or what do I have to contribute? And that's just not true. I have so much to bring to the table, and everybody's experiences, different as they may be, have something to contribute to this fabric of healthcare, dentistry, research. It's all interconnected. And so understanding and trying to reframe your thought process to say, how can I utilize what I have and just build on that and put it in a different context? It's okay that it doesn't look exactly how I thought it was going to. How are we going to make the best of the situation and use it to grow, right? Like,
Yeah.
I think that sometimes we get caught in a one track, narrow mind, and that has a limiting growth perspective. And being a lifelong learner and being someone who really truly stands behind as an advocate for continuing education, what can I take from this experience and bring it to the forefront, to hygiene, to research, to education, all of that.
Yeah. I talked to so many people, and it's like I was interviewing someone the other day, and they said, I always thought in my mind that in order to write or to contribute to a magazine or wherever, I had to have a certain degree. And I I, I think we're limiting ourselves, like you said, that a limiting belief. So what in you makes you feel that way? Why, who told you that about yourself? Is where I always start, because I'll even catch myself now in my day-to-day life going, I'm going to do this, and I don't know that I can. And I'm like, hold up, Kelly. I'll say out loud to myself, what made you think that? And then I
Yeah.
realized that it goes back to my childhood, or it goes back to something that I thought that I learned about myself when I was 18, 23. And I'm going, that is not today. That is not who I am. This is not, that was even limiting. So I think as we grow, as we evolve into who we are, we need to still continually question who we are to ourselves, and who we are to other people. Because Brooke, you're coming here, you're presenting research with one of your former professors at your previous institution about mentoring. And
Yes.
who would have thought that you would have done that? But when we go back and we realize all the things that we've done, we probably always questioned ourselves when we went out of our comfort zone, right?
Absolutely. And it's interesting to me that a lot of people will take the negative and criticism that they get and hold so much weight to that rather than celebrating the positives or taking, the wins as they come at you. For some reason, the weight of negativity just sticks so much more.
Yeah.
And
Yeah.
so challenging that belief and saying, this is everything that I am capable of, and facing that head on. And I like to look at it as what's the worst that can happen? And in this situation, how do I face that adversity? And if it doesn't work out in my favor, what's the worst case scenario with that?
Yeah.
And you would be so surprised with how many hurdles you can jump through and how much more you're capable of by going at it with that mindset. And so I thought that I would go into, because I hope to become an instructor and educator, I always thought that I was going to do a master's in public health. That's kind of where I saw myself going. And I'm currently doing a master's at NYU in clinical research. And
Cool.
it just felt like the natural fit for me. I didn't even know that that was an option that was available. And it's going to serve me so well in my future and what I hope to bring to the table, And
Yeah.
so without that growth mindset and without feeling like you can handle this challenge and it will be okay, everything will work out, it's so important.
Because we think that what I've learned through coaching, through mentoring, all the things is that many times we think that it looks some way. It's like probably when I graduated hygiene school, I thought I was going to be a clinical hygienist and that's what it was going to be. And then I started asking different questions of myself. But also to your point of, going in and doing that, proving to myself time and time again that I could stretch beyond my own belief system. And then I started asking myself, okay, why do I think that it looks like that? And what if it ends up so much better? If it could be this or even better? And then
Exactly.
the universe, God universe, proved to me time and time again that it was always better than I had imagined. Always, every time.
And like reframing it so that you don't think of an experience as a failure or as a loss. Everything you're going to learn from, everything that you're going to grow from. If you try and you don't like it, that's okay. And that's actually more important, I think, to identify something that's not the right fit, to know that you can go and push past that and then make something even better out of it. Just like you said, better than you could have dreamed it from the start. And you have to go through those trials and tribulations in order to get to that goal. And I think that we're all on this path of growth and self-discovery, and we're not quite there yet. And it's all of these little experiences that help shape us to be able to get there and have an impact and have a voice and share that. Because, maybe somebody's going to watch this and say, hey, I didn't know that I could be a research hygienist, or I didn't know that I could take this avenue that wasn't brought to me from the beginning. It doesn't have to be cookie cutter. It doesn't have to be what your friends are doing, what your peers are doing, what your colleagues are doing. You can have your own unique identity, and it can be so impactful.
Absolutely. Because I've found out and I find that when you get clear on what you want, it comes to you, it attracts. Just like if negativity, if you're saying that something's going to be negative, you're attracting something negative.
Exactly.
If you say that this is what I want to do, here's my gifts, and what if I could do that? And what if I could do that? Then you're attracting all of that as well. And you guys, anything that you want is possible. And, Brooke, you're making an amazing difference. You said, I have so many things I want to talk about because I just love your mind and the way you think. We're so aligned. You're now researching. You have a few ongoing research trials and things like that. Tell us more about that and how you think that will impact the everyday hygienist.
Yes. So I'm got my hands in a couple different pots here, and I work on a couple of different trials. So from the space of the dysplasia or the precancer patient, I'm on a NCI government-funded trial that is looking at the off-label use of metformin, which is a commonly used drug for diabetes, and how it can be used off-label for people who have precancer, so dysplasia or hyperplasia lesions, to either halt or, improve the progression of that precancer. And this is a phase 2 clinical trial. So they're seeing really wonderful results so far. And how wonderful would it be if we could get this FDA approved drug that is, on the market, easily prescribed, very little side effects to the patient. If we could implement that and not have that lesion progress to a cancerous lesion. Squamous cell carcinoma, the 5-year survival rate for that is 40%. It's one of the worst in the body. So we need to look at this and tackle it. And how can we make it easily accessible to clinicians, dentists, dental hygienists? We could have some sort of chair-side saliva test, swab, blood test, finger prick test that we could identify those at-risk, high-risk patients. We'll be able to serve them so much better and have confidence in our skills. I may not be, you may have a hygienist that's not very confident with their oral exam of precancerous lesions, but if you have something quantifiable that is accessible, it's going to make a huge difference. The other study that I work on that is with cancer patients, we're looking at the biomarkers that are affiliated with those types of cancers to see, if there's something to predict this, again, in hopes of being able to get in there before the lesion progresses and before it goes to chemo, radiation, surgery. We don't want it to get there. So how can we do this early detection and early treatment is ultimately the goal.
So you're doing somewhat of a predictive analysis at this point?
Yeah, so the data that they're collecting is looking at how we can implement that and how can it be used.
That is so cool. So I heard you say with the first one that you mentioned, that it could potentially be, because many states, you could potentially be like a chair side finger prick test that we're doing, just like diabetic patients do. Some states don't allow that.
Yeah.
Some do with their chair side testing. So I feel like if this is something that you could identify, it would help encourage those states get that capability for more of a screening, surveying. Because what I found with teaching, we still taught the blood glucose monitoring chair side with our patients, whether they were diabetic or not, even though it's not a law in Virginia, but you sort of have to integrate it at some point to be able to do it, right? But when we were doing those chair side finger pricks, we would pick up on undiagnosed diabetes, undiagnosed lots of things that were probably attributed to that blood glucose level. And we would stop what we were doing and we would say, okay, tell me more about your medical history. And sometimes we'd have to dismiss, obviously. So there is a direct implication for this. And you're informing Brooke from I always call it my version of world peace. I mean, you're a part of our world peace, right? And solving and preventing diseases by doing what you're doing every day. So thank you for that, because it takes all of us to do that. And also too, I think it's sometimes important, I know it is important for that to happen, to inform the legislative pieces to paint the bigger picture for the everyday clinician that is going, why is that not reacting to normal treatment? Why is the patient exhibiting these clinical signs and symptoms? And it's confounding. So, by what you're doing every day, it helps inform the larger picture.
Yep. That's the goal, right? It's to educate the patients to be doing self-checks and understanding that you shouldn't come in when something is in pain, when something is so overt. We want to identify it at the very, very first stages. And that's going to come from legislation. That's going to come from clinician education and understanding, and these hopefully diagnostic and pre-diagnostic tests that is going to make it easy and a new, I hope, standard of care to implement that and be able to save a lot of people.
Yeah, not just screen for it and see if they already have it, but how are we screening for it to say, do you have the predictors of it?
Exactly.
Do you have, whether it be a cheek swab, whether it be whatever. But the main thing that I would love, and some companies are coming out of it, is chair side testing, not where you have to wait 24, 48 hours to send it somewhere and to get that test. I mean, although that's still valuable, but I would love to be able to see it chair side.
Yeah. Yeah, absolutely. I think that's where the future needs to be. And if that future can come ASAP, it will be a better place.
Yeah. So what do you see as like the next exciting step for your career? Is this what you want to do for the rest of your life? Do you think that you always want to be a researcher combined with a clinical hygienist? What do you think?
I think that at least for now, I'm very fortunate to do what I do and be so passionate and feel like I am making a difference. The next big step is to graduate. So that's coming in May 2025.
Oh,
And so
good.
then I'll have a master's. And, I would really like to try my hand at education. I think that it's something that I could be really good at, something that I could, share my story and help other people progress in their career and find that same joy, love, and passion for the profession of dental hygiene. So I would love to do that and keep going with the research and kind of have this multifaceted looking career that's not just one thing. I think that I've just discovered about myself that I thrive and flourish when I'm presented with lots of different experiences and opportunities, and take that and run with it.
Yeah, we are multidimensional humans. And I know that with my family, this is what you did. It was this one thing. And I always was doing 12 things. And they're going, what exactly you're doing? And I'm like, what I love was always the answer, what I'm passionate about. And Brooke, we need you in education. So
Yes.
can't wait till you graduate. You being a phenomenal educator.
Oh, you're so
And
kind.
no, sincerely. And you can do it all. And that's what I tell everyone. You just have to make a decision of what you love and go down the path of curiosity and follow that. And it sincerely shows up for you. So, from today's podcast, you guys, if you want to reach out to Brooke, her contact information is in the show notes, which means the notes section underneath the podcast. You can reach out to her there. She's on Facebook and she's accessible by email. And Brooke, any final words, any advice, anything that you would like to tell our audience?
I just want to say thank you so much for having me today. It's been an honor and a pleasure to be able to chat with you. I think that we've talked a lot about inclusivity and mentorship and just getting the conversation going. So I love your platform and I love to be a part of it. And I would just say to anybody watching who, maybe is at a crossroads in their career or their life and they're not sure how they're going to, come back from this or what to do next, just try and just go for it. And positivity will come your way, and believe in yourself. And it may not look how you expected it to, but good things are coming your way, and just keep that tenacity and that open mind.
I love it. Thank you so much, Brooke. Thank you for being on today.
Thank you so much.
Yeah, I'm so excited for everything. I can't wait to hear all your updates. And for our listeners, thank you so much for what you do every single day. I always ask the favor. I do. Give us 5 stars on Apple Podcasts because they're the one that matters when it comes to rating. And go on over to YouTube, click the like button because the algorithm recommends other people who will enjoy our show, and subscribe and share to people that you love. We will see you next time, my friends. Brooke, thanks again.
Thank you.